Thank you for joining Understanding HIPAA Compliance, Physical Security. We will be starting shortly. We will wait a few more minutes for others to join us. Thank you for joining Understanding HIPAA Compliance, Physical Security. We will be starting shortly. We will wait a few more moments for others to join us. Thank you for joining the BioMedix webinar, Understanding HIPAA Compliance, Physical Security. My name is Mike Hamilton, the Associate Product Manager for TrackNet PM at BioMedix, the sponsor of this webinar. Our speaker today is Dr. Michael Brody. Dr. Michael Brody is a nationally recognized speaker presenting on health information technology and electronic health records. He is a featured health information technologies writer for Podiatry Management Magazine, APMA News, and the PICA newsletter. Dr. Brody received his DPM at the New York College of Podiatric Medicine, is involved in resident education at VAMC Northport, and has been in private practice for over 20 years. We do have 3 housekeeping notes. If you have questions, please type them in the question box to your right. We will have time at the end of the webinar to answer some of your questions. There will be survey questions at the close of the webinar. Please take the time to answer them. We appreciate your feedback, and it will help shape future webinars. After the webinar, if you do have any questions that have not been answered, you can email info@biomedix.com. And at this time, I would like to introduce Dr. Michael Brody.
Thank you, Michael. Welcome to our continuing series of HIPAA compliance and HIPAA security. When talking about HIPAA security, we need to remember there are 3 aspects to HIPAA security. We have administrative measures, and those are the policies and procedures you have administratively to ensure you have security. You have technical measures, which are what you do physically to your computer network to ensure security, and then you have physical security. Today's lecture is about physical security, which are the measures you're going to take for your physical location to ensure that the medical records that you have in your office are secure. Now, when we talk about security, and this is true for whether it's technical, administrative, or physical, we have 2 types of measures. We have addressable and we have required. A required item is something that you must do. There really is no wiggle room. You have to implement that particular measure. An addressable measure is a measure that you must address to the best of your ability. When you look at the HIPAA rules state that you must meet the HIPAA regulations to the level that you have, to the level that you can within your organization. So it is known as what's scalable. So you are required to do what is reasonable and within the resources of your practice. Now, when we talk about addressable items, if you are going to do something completely, you describe how you're going to do it and why you're going to do it. If you're going to do something in a minimalistic fashion because it's beyond your resources, you will discuss what you're going to do, why you're going to do it, and why your resources limit you to how you're going to meet that measure. Your manual has to be properly customized to reflect what you are doing and what is within your resources. Now, the first group of measures are known as facility access controls. These are the policies and procedures that you're going to use in your office to ensure that only people who should have access to your facility and to the technology, computers, backup disks, etc., in your facility are set up properly. You want to make sure that if they are not supposed to have access, they don't. And if they are supposed to have access, they only have access to the items that they should have access to. For example, not everybody in your facility or in your practice should have access to the server. They may only have access to workstations where administrators would have access to the server. So you're going to set up controls to both in policy and in physical items to ensure that people don't access what they should not access. Now, within this group, the first thing you have are your contingency operations. You must have a contingency plan in place. Now, your contingency plan is what gets activated should there be some sort of physical disaster to your office. That physical disaster could be a fire, a flood. It could be a complete power outage where you have no power in your facility. Now, this is an important issue because one of the aspects of HIPAA are that you have to keep your medical records available. If your facility, if your practice is no longer functional, you still have to be able to access your medical records to be able to communicate with and provide care to your patients. So you must have a contingency plan to allow you to access this data. That contingency plan could be anything from as simple as a laptop with your EMR software loaded on it and loading up your most recent copy of your backup to renting space at a disaster recovery center. What you do there, once again, addressable. You address what is appropriate and what you can do within your resources. Once you have your disaster recovery plan in place or your contingency plan in place, then you have to decide who can activate it and who has access to that laptop or to the disaster recovery center, and then you determine who can do what. So this is where you have your contingency operations and you're limiting who can access it and who can implement your contingency plan. The next item is your facility security plan. This also is addressable. Obviously, you want to have security in your office because you want to make sure people don't break in, people don't steal things from you, but you have to have security for your data. Your security plan will discuss what your physical security is. This could include locks on windows, locks on doors, motion sensors, video monitoring, whatever you do. And what you're supposed to do is what is reasonable for your organization. So if you have the ability to have remote monitoring of alarms, such as fire alarms and burglar alarms, and it is not expensive, then it's reasonable for you to do that, and you should do it. If that is not available where you physically are, then it's not reasonable to do because it's not available. Do you need to have video monitoring? That's really not necessary for a small practice. It's outside of what you would need, and the cost is prohibitive. But to have door and window alarms on every door and every window is reasonable. So what you have to do is look at what you can do and what is reasonable based upon your resources. And you need to do what's reasonable based upon your resources and document what you have done. Once again, this is addressable because you have to have a security plan, you have to have security, but to what level really is based upon what is reasonable for you. The next item is your access control and validation procedures. Your access control and validation procedures are the procedures and policies you follow to decide which of your employees have access to what aspects of your computer system. For example, who is allowed to touch and log into the server, who has administrator accounts, who has secretary type accounts, who has doctor accounts. In addition, you're going to want to monitor who else has access to your computer system. You may have hardware and IT vendors who work on your system. If you are giving them access, you have to make sure that they are monitored and their access is under your control. Therefore, when you have someone working on your computer systems, especially if they're working on computers with patient information on it, you want to have somebody from your practice actually physically there with them. In addition, you want to make sure that you have business associate agreements with anyone who is going to be touching your computers and may have access to your patient data. The next item is records maintenance. Now this once again is addressable because you can do it in a manner that is appropriate and works well for you. But your records maintenance, you want to keep track of time, date, and repair of any modifications to your office. If you're changing the logs, when they were changed, who changed them, and the details of why they were changed. You want to have a complete description in this records maintenance log, and you want to see and say why it was done. If you're changing a lock because the keys are worn out, fine. If you're changing a lock because an employee left that under, shall we say, unpleasant circumstances, and you want to make sure they didn't make a key, that's fine. But you have to record what you've done. So whenever any physical aspect of your facility undergoes repairs that could relate to security, and that means your windows, your doors, external and internal doors, you need to have a log of what happened. How you do this, whether you keep a paper log, computer log, doesn't make a difference. And then you have to have the outcome. Was the repair successful? What did you have to do, and why did you have to do it? This is an important aspect to it. How you do it is up to you, but you really do have to do it. Your next policy is your workstation use policy. Your workstation use policy basically states what your employees are allowed to do with the computers, whether they're during their free time you allow them to surf the web, whether you tell them there are certain websites you cannot go to, there are certain types of websites you cannot go to, whether you tell them that you're not allowed to do file sharing or downloading. Whatever you decide your policy is, you must have this documented in your HIPAA manual, and you must make sure that your employees know what your policy is. In addition, you're going to have to monitor and make sure that your employees do follow your workstation use policy. The next station is workstation security. Once again, this falls in the category of access control. Who can get to your computers? The security of the workstations means who can actually touch your workstations, who can touch your computers. You want to make sure that your computers are in secure locations and are properly monitored in order to make sure people don't touch them who shouldn't. This is especially important with mobile devices such as tablets and laptops. If you're assigning somebody a tablet or a laptop, you want to log who has that laptop, who has been assigned to that laptop, and make sure that they actually take good care of it. They are responsible for making sure that the laptops are secure. The most common cause of a HIPAA violation is a lost or misplaced laptop. So this workstation security issue is a very, very major item. Next item is device and media controls. You want to make sure you know where each of your devices are, which ties into making sure that you know who has laptops and who has tablets. And you want to make sure that if you're using removable hard drives or flash drives or other media to transfer data, you know where they are and who is touching them. You are responsible for each of these items if they contain patient information. So you want to keep a log of it, and you want to make sure you know what's going on, and if something is missing, you need to take appropriate action. Next item is a disposal policy. What are you going to do with your computers and with your hard drives when you retire a computer? Because those hard drives can contain patient information, and that information can get out into the wrong hands if you simply take that old computer and put it out on the curb. You have to make sure that when you dispose of hard drives or other media that may contain patient data, that the information is totally, completely wiped off of those drives. I strongly suggest when retiring hard drives, utilize a hard drive shredding service. A shredded hard drive is a hard drive that no data can be taken off of. Another thing you need to remember and be aware of is that a lot of the digital copy machines and fax machines today actually have hard drives installed inside the machines. And these hard drives inside the copiers and faxes have a record of every copy that went to the copier and every fax that came and went. These hard drives are treasure troves of personal identifiable health information. You have to make sure if you turn back a copier on lease, open up that machine, take out the hard drive, and shred it. If you have a computer that you have a service contract with and the hard drive dies, you want to make sure your service contract allows you to remove the hard drive. Sorry, and the computer dies. You want to make sure that you have a service contract that allows you to remove the hard drive, hold on to it, and then send the computer in for repair. You do not want to ship out a computer with a hard drive in it to a computer repair facility because you are not sure you're going to get the same hard drive back and you don't know who's going to touch it. So when you buy service contracts, make sure they have a clause that allows you to keep the hard drive and you don't have to turn it in when you send the computer in for repair. The next item is a media reuse policy. Well, we all take disks and we use them, then we erase them and use them for something else. We have to have a policy and procedures in place so that way if we take a flash drive or removable disk or other medium and then want to use it for something else, that we properly and thoroughly erase any and all patient information on those disks. So we have to have a policy and procedure in place that ensures that when we take a disk and retask it to something else, that there's no patient information on those disks or flash drives. This will help to ensure that patient information does not end up in the wrong hands by accident. Now, the accountability, once again, we went over this earlier, but it's worth refreshing. When you have laptops, tablets, and mobile devices, you want to track who is the device assigned to. You also want to track who is assigned to each workstation and who is responsible for the security of each workstation. So if somebody has a specific workstation and they leave it unattended and still logged in, you know who's responsible for it. Now, if workstations are shared, then the accountability is also shared for that workstation. The next item is data backup and storage, which is an addressable one. Well, addressable seems strange because we do have to back up our data. Well, you have to back up the data, but how you back up and how often you back up really is up to you. I recommend backing up every day in an incremental backup and once a week doing a complete backup. That's my personal preference. You may have a different preference and your IT person may say they're going to back up differently. A lot of it depends on how you're backing up. You may be utilizing backups to a removable hard drive. You may be backing up to flash drives. You may be backing up to an online service. How often are you backing up? Where is the data stored? And who's responsible for making sure that your backups are done properly and are accessible when you need them? Now, physical security, and you think about it, it seems simple because it's just making sure that people don't touch what they're not supposed to touch, that you have locks and alarms in place, and you're keeping track of all your hardware. But physical security, which seems the simplest to implement on the surface, is actually the largest cause of data breaches and breaches of personally identifiable information that exists with health information technology. The ONC, the Office of the National Coordinator for Health Information Technology, maintains a website. On that website, they list all major breaches. A major breach is a breach of information that involves 500 patients or more. If you do a Google for ONC breach list, you will find that 95% of the breaches that involve 500 patients or more, which means 95% of the breaches that are going to result in a major fine, are laptops and media that was left someplace where it shouldn't, walked, or was stolen. So your physical security, where it seems the simplest, is actually the most important aspect to make sure you get it right, because this is probably the most common place for your HIPAA security plan to break down. So it's very, very important with this in mind that you take the physical security of your computers, laptops, and media extremely seriously. Now it's time to take some questions. If you look at the box to your right, you can go and type in your questions, and I'll be glad to answer them. Okay, we're still waiting for some questions. If you're not sure how to ask a question, there's a little orange arrow to the top right of your screen. Click on it to expand the box, and you'll see an area for questions. Click on that to type your questions. First question, is there a general manual available? I have created a HIPAA manual which covers all the things we spoke about today and the technical administrative measures. And if you just give me your email in the chat box, I'll be glad to send you information on how to get that. And then for Daniel, where's a good place to get HIPAA manual? If you go to my website, which is www.cmeonline.com, there's a tab that says Downloads. Under Downloads is the thing HIPAA Forms. In the HIPAA Forms, there is a HIPAA questionnaire. All the questions that you answer there are the basis of your risk analysis. Based upon the risk analysis, you can build your own manual, or if you want, send me the questionnaire and I will create a custom manual for you. I was just asked to repeat the website, www.cmeonline.com. CMEONLINE.com. Okay. And I've got a number of people asking me for the manual. I'll give you my email address so you can send me a request for that. It's mbrody@tldsystems.com. Let me do this here. I'm going to type this in. Okay, I just typed in my email address and the web address into the chat box. Hopefully everyone can see that. Now, does anyone have any questions about today's lecture as opposed to simply about getting a manual? So everything was perfectly clear and everyone understands everything, or I put you all to sleep? I'm not sure which. Okay, Lindsay, I don't see any more questions coming up.
Thank you, Dr. Brody, and to all the attendees who joined us for Understanding HIPAA Compliance, Physical Security. For more information about BioMedix or our products, please visit www.biomedix.com, call 877-854-0014, or email info@biomedix.com. Join us for tomorrow at noon Central for How to Effectively Market Your In-Office Vascular Testing Device webinar with the Vice President of Marketing at BioMedix, Meg Heim. And join us again on Wednesday, October 26th at 7 p.m. Central Time for laptops, tablets, desktops, and other devices for accessing your EHR, what is best for your practice. To register, visit the events page at www.biomedix.com and click on the webinar link. For more information on upcoming webinars and trade shows, visit the events page at www.biomedix.com. And please remember to fill out the short survey. Your feedback is appreciated. And thank you. We are adjourned.
Okay, Mike.